Hello.
As I stated in my remarks earlier, Mr. Chairman, I think that targeted messages, the kind that you talked about with Dr. Roper this morning, that they're not doing. I think the targeted messages where people see themselves in the messenger. And I think that that is one of the major reasons why the numbers of HIV infection rates in my community and other communities of color are because we did not see ourselves in the messages early on in this epidemic. So to answer your question, I think for young youth of all colors, we need to have campaigns that they see themselves in the messages. I think the messenger is as important as the message.
In your view, how effective are CDC's TV and radio ad campaigns?
It was interesting seeing Mr. Kroger here because I had participated in their focus groups for the last 3 years. I've been a part of that America Response to AIDS campaign. They brought me in as an expert on the issue of prevention and education. And every time I was involved in their campaigns, I told them, again, the same thing. They need to be more specific. They need to be specific to people of color, to gay men of color, to youth. And they've never listened to those of us in those groups who were advocating for that. But yet and still they'll bring in these things that they brought in today that they've spent lots of our money on, and still we're not getting the kind of product
listening to Lee Iacocca.
Yeah, right, exactly. You know, that sort of corporate mentality that they're using down there, which I resent. I resent very much. He talked about his resentment of being charged that they are ignoring groups. I resent that they are using that kind of corporate mentality in dealing with this epidemic. I'm dying from this disease. I've lost thousands of people in my life, hundreds of people in my lives, and thousands more are dying around this country from this disease. And so I resent that implication that he made to the committee this morning.